I'm here with Dr. John Edward Asmar, a member of the American Association of Orthodontists. Dr. Asmar's career begins with a Bachelor in Arts and a Bachelor in Science at the University of Miami. He then proceeded to attain a DMD at University of Pennsylvania School of Dental Medicine. He then achieved the title as a Doctor of Medical Science and also attained the Certificate of Advanced Graduate Studies at Boston University Goldman School of Graduate Dentistry. He is also a member of the Fellow International College of Dentists and as well the Fellow American College of Dentists. I was wondering why you joined the American Association of Orthodontists and how long you've been part of it.
I've been part of the American Association of Orthodontists ever since I went to my ortho program. And so you first join it as a resident. And so I joined in 1988, graduated in 91, and I've been now for 22 years in the American Association of Orthodontists. I joined the AAO because as an orthodontist, you want to have the continuing education that it affords you by being in it. It affords you the chance to be with your peers, with people that have like-mindedness as you. They have a very good, very strong ethical background, and it's also the association is an advocate for the patients on treatment of the patients. It gives you guidelines on how to be a better orthodontist. So that's why I joined it. You get the classes, you get the
Mm-hmm.
courses, and you also are with a group of like-minded
Mm-hmm.
peers. Well, we like to. There's usually one big meeting a year. It's the international meeting of the American Association of Orthodontists, and at that point, you also have a trade show where you get all the latest technologies, all the latest wires, bands, brackets. You get lectures that are given by people who are doing research in different subjects to better and to actually
Mm-hmm.
make orthodontics a more advanced field. Um, the goal of being in it is that you're meeting with people who are at the forefront of their respective areas, and then you go to these meetings. You get a chance to really um, uh, bounce ideas off of your peers. You get to show cases, learn about how new modalities of treatment, and not the least of all is the camaraderie that you have. The friendship that you make, lasts you a lifetime.
What do you value in the relationships that you've created?
Well, orthodontics is a protracted treatment. You don't do orthodontics in one sitting. Most
Uh-huh.
patients are about 2 years treatment. They're in treatment for about 2 years. And we live in a transient society. So you have patients that actually start with you and might leave to go to California or might go to Italy
Mm-hmm.
or go to Spain. When you go to the AAO meeting, you get to meet peers from all over the world. You have friendships that you start together, and then when your patients need to be transferred, you actually know these people, you know their philosophies, you've seen their cases. So it helps the patient in being transferred to somebody that's going to follow up on the treatment you started, as opposed to just, looking in the directory and put your finger and say, okay, you're going to Italy,
Mm-hmm.
go to this person. So by going to the meetings, by actually being there with all the different orthodontists from the world, you get a chance to really get to meet them. You get a chance to know them, and at the end of the day, it makes sense for your patients that if you need to have them go somewhere. Also, you're on the receiving end. I'm in
Okay.
Washington, D.C.,
Uh-huh.
and there's a lot of patients that come from to embassies, international people that come in. So I get a lot of patients that have come to me because at the AAO meeting, I've met people from all over the world, and then they know that if they send me their patients, I'm going to follow up in a certain
Uh-huh.
way with ethics, with the same values that we have. We all belong to the same organization.
So, do you have a role or position in the AEO?
Well, I have actually two positions mainly. The AAO, the American Association of Orthodontists, is subdivided into 8 constituencies. And I belong to the Middle Atlantic Society of Orthodontists, which is a constituent of the American Association of Orthodontists. As such, I belong to the board of the Middle Atlantic Society, and I'm specifically the treasurer of that society. So within our board, within our group, we actually take care of our society specifically, or our constituency, which encompasses DC Dental, the District of Columbia, Maryland, Pennsylvania, Delaware, New Jersey, Puerto Rico, Virgin Island, and Guam. This is the Middle Atlantic Society of Orthodontists. Furthermore, I'm also a delegate to the American Association of Orthodontists. The House of Delegate is made of 64 delegates that come from all 8 constituencies, and our constituency is the third smallest. So we have 7 delegates, and I'm one of those delegates. And it's very nice because you get a chance to make policy of what needs to be done for the American Association of Orthodontists. We also have a chance to work with healthcare professionals, how orthodontist is part of the overall healthcare situation.
What are the expectations that the association has for you and for other members, and how are you different from other orthodontists?
Well, first of all, it's not that you're different. It's you cannot belong to the American Association of Orthodontists unless you have gone to an actual accredited program from the American Dental Association. So you cannot belong to the AAO unless you are a real orthodontist. Now, in the United States, if you're a general dentist, you have the right to do any specialty you want. You can't limit your practice to a specialty, but you can go to the University of Holiday Inn over a weekend and learn how to put braces on and say, I'm an orthodontist. So you do want to belong to the American Association of Orthodontists because it actually tells your patients, it tells everybody that not only, that you went to an accredited program and that you're keeping up with what's going on. So if you're an orthodontist, even if you went to an accredited program and you choose not to belong to the American Association of Orthodontists, you are not held to the same standard. You don't have that peer review that comes with it. So in a way, it keeps you focused. I think it gives you, because you're with people that have the same values, it keeps you focused on getting the ethical to be more ethical.
So what do you value most about the AAO?
Probably what I value the most about the AAO is the continuing education that you get. There's one meeting every year from the AAO, and it's usually a 6-day meeting where you've got several lectures, and you will have it simultaneously about 8 different lectures you can go to. And every hour and a half, 2 hours, you get 8 next. So you can get so much information in those 6 days. Everything that's happening in orthodontics and oral surgery, anything related, you see it. And then on top of it, at the constituency level, they have also an annual session. So if you go to the annual session of the American Association of Orthodontists and you go to your annual session of your constituency, you're actually putting in 9 to 10 full days of lectures, and that is invaluable as continuing education to stay at the forefront of your specialty.
Okay, thank you.
You're welcome.
Dr. John Asmar clearly identifies his role in the community of the American Association of Orthodontists and the community created within the AAO. He is a member of the board, treasurer of the Mid-Atlantic Society of Orthodontists within the executive committee, and one of the few delegates of the Mid-Atlantic Society. In this regard, he clearly expresses the AAO's mission statement, which is to promote the ethical delivery of quality orthodontic care by providing its members with educational opportunities and information regarding advances in orthodontic treatment and technology. He also advocates for the community in its ability to ease the exchange of clients without compromising the client's procedure, and thus illustrating the community of the AAO, its qualities, what members value from it, and its purpose in both the members' lives and the clients' lives. If I were to ask one last question, I would ask how it impacts the clients' lives, more than just the members. Nevertheless, thank you to Dr. John Asmar for sharing an insight into the American Association of Orthodontists.